Okay, this is lecture number 3 in the series Contemporary Aesthetic Dentistry, almost a residency program. Sorry there's no video in this particular lecture. Hopefully that doesn't disappoint. There will be a couple more through the series. Okay, so we're still in part 1, which is really the most extensive part, talking about what is aesthetics, artistic principles, all the way through analysis, photography, and Photoshop to come. So this is again for people more toward early in their career, beginners, intermediates, but certainly I think it's good for anybody that's interested in art. So I'm going to talk a little bit more, not a little bit, but about artistic principles, really how artists think and how artists evaluate and learn, and how this applies to dentistry, because it's very valuable, I believe. And it's really the things that we do to create teeth, and several of the evaluation techniques were taught how we look at teeth and design teeth. Tell you an interesting story here as you look at this image here. Can anybody recognize who did this art and who did these drawings? Some maybe not. If you went to buy these drawings, you would spend neighborhood of millions of dollars. These are the very first drawings of Pablo Picasso. So look at those drawings. I think he was about 8 years old when he did those drawings. His father was an art instructor, and I think he even resisted to learn art. And he was just like everybody else. If you look at the top drawing, I think he was 8 years old when he did this, is what I read about this. And looks like a kid drawing some stick figures, like probably any of us that did this when we started drawing. And then he evolved a little bit. I think he did this when he was 12 years old. I think any of us that did this would think that, well, maybe we had a little bit of talent, but we don't see any of the brilliance that we know that came from his career. And the uniqueness of what he did. And so the point I'm trying to make is that if we study and we learn the principles of art, we can all become artists, really. And maybe not to the point of a Michelangelo, but to the point of being great dental artists or great sculptors or great painters, not to the point of being able to sell our work for millions of dollars, but certainly if we study and practice to the point of certainly satisfying our patients. Next in the evolution of his career, I believe he did this when he was 18 years old, and you can start to see the significant improvement and understanding of the ability to reproduce human form. And what I want you to see in this evolution, what his father had taught him, was really in the initial part of an artist's career or a great teacher, was teaching him really not to essentially be creative. Maybe that's a poor choice of words, but basically really how to perceive. And I believe he did this right around 20 years old. And the process was, in art school, and what I learned from Betty Edwards, was to first learn how to perceive, to see exactly what is in front of you, perceive what's in front of you, whether you're drawing a microphone, which I'm looking at right here, whether you're drawing a glass or reproducing a tooth, to see exactly what that is and reproduce or copy, to become a great copier. First, once you become a copier, then you can develop your own extension of your individualization of what your style might be. And we look at all even great ceramists. I could show you or show you pictures of some of the great ceramists, the Willie Gellers, the Claude Siebers. They all have their own individual styles. The ones of today, Naoki Hayashi, Firis, Yuazu. I mean, they have their own individual style. Great, individually great, but a little bit of a style to their work. Well, first they all had to learn to copy, and this is some of Picasso's work later in his life, and you can see the fascinating genius to it, the composition, the wildness yet uniqueness to it. But that couldn't have happened before he learned how to copy. And so I want to talk about now the 7, and there's actually more, but if you went to art school initially, they would teach you these basic principles called the 7 basic principles of art, or artistic principles, that you understand you would have to master before you move out of basic art school, and understand how to create these principles in your art. And if we create something similar that I'll share with you in a second in our dental compositions, that we will have something that creates a very pleasing perception, like I mentioned in the previous lecture. And artists talk about balance, so they use the word balance, and then they go on to say a blend, though. It's a blend. Balance is a blend of symmetry with subtle asymmetric elements. And there's sort of a radial symmetry to it. So there's always a mention that there's no perfect symmetry in great art. And I showed you in the previous lecture a couple of examples when there was perfect symmetry, how that created a sense of artificiality. And we will talk about that a little bit more in this lecture. There's also an emphasis in great art. There's an emphasis, there's an object in the art that has some emphasis. It's overemphasized. There's not a redundancy of element after element after element that's the same. And that's a mistake that people make in their smiles, and we'll talk about that. There's a certain proportionality to it, that there is a scale from maybe front to back that makes visual sense. There's a certain blending to that. There's a variety to it, that there's not essentially a boringness to it. And the variety in our work is created by a blending of colors, a subtle contrast, a subtle interest in shape. Artists talk about movement and rhythm, and the movement meaning to draw your eye in a direction, rhythm meaning flow of the work, how it flows in a direction and how they capture your interest. And I can't possibly, in a short lecture, go through all of the details of what an artist would think about, but I can give you a sense of how you should look at a dental composition and go through in your mind how to create one. And then they talk about, in the end, the 7th principle is really to create a harmony. So as you look at the work, all of the elements sort of blend together, and the elements work in a composition. So nothing is really fighting in the work. And there's very few in history, just to back up, very few artists that was able to fight that harmonistic sort of feeling. And you can see in Picasso's work where there seems to lack harmony in the right, left, north, south, so to speak, of his work, but yet there's this sort of visual synthesis of the elements of the work that somehow come together. And that's the genius of his work, that so few, he was the first one to do it, and a few have created it since. So to move forward then, how does this relate to what has been taught in dentistry? So we use the terms symmetry. We say we want symmetry in our work, but all of the great teachers that have taught about dentistry, about the art of what we do, all talk about, and I'll show beautiful examples of this, or some examples anyway, of that there needs to be a subtle asymmetry into what we do, and a subtle little below the visual comprehension of our work that we see in our work that is not a perfect right-left symmetry, because that gives the sense of artificiality. And we see people trying to, with visual effects in movies, trying to create humans, and we can all sense when there's too much visual effects, special effects, because it looks artificial. We still love that naturalness, that natural beauty, and I'll give examples. And in our work, we talk about dominance or an emphasis, the central incisor having the clear sense of perspective or dominance in our smile, but not overwhelming. And I'll give examples of that. And proportion, creating the correct proportion between the central and lateral and canine. And the beauty of working, I'll show you with Photoshop or some smile design programs, we can measure that, we can create correct proportions from one tooth to the other, and that's important that we're able to do that, obviously, to maintain that aesthetic, pleasing proportion. And from the artist's world to our world, the dental art world, variety is really a direct correlation in that we need a subtle variety in the incisal gingival color of our tooth, a subtle variety in the subtle changing shape of our tooth, a subtle surface texture. If we don't have that, we see what I showed in the previous lecture, where it is then perceived as extreme artificiality at the full facial view. And then we use the same skills that artists use in creating. We use illusions, we use light, we use shadow, and I'll show you how I do that, or how it's been taught, and how I use it too, to create the illusion of width, the illusion of narrowness, the illusion of change in shape, to create an aesthetic or pleasing proportion. And then the last thing that artists always use in their work is they frame their work in a certain way to create an overall emphasis of their work. And in what we do as dentists, we use framing, we use the lips, we use the gingiva, so we have the ability to alter frames, the gingiva, and things like that to create our dental composition. So let's go through those principles of what we do. So the principles in the art world or in the architecture world, if you look around, and I think we all notice this at a subconscious level, if you look at just any building or walk around New York, for example, I mean, nobody builds a building like this anymore. This is around 1930s or probably pre-1930s. I mean, it just has an extremely boring look to it. Every piece of architecture that's being built today has this subtle little asymmetry to it, a subtle little extension or subtle little rounding or something like that to give us that perception, that little interest. And sometimes we see something, I don't know if I want to use the word gross, but grossly distorted. And most of the time we tend to like that interest to the shape. If we look historically at buildings that they still leave standing, that they haven't torn down, the Leaning Tower of Pisa, must be hungry, that we all know is falling over, and they're supporting it. They're having to support it so it doesn't completely fall over. It has an extreme interest to it because of its subtle asymmetry. And we all like things like that. Now let's look at this natural smile. And we're going to look at it close in just a second. I would hope that you all think that is a pleasing smile. We see a dominant central, we see a relatively bright color, a good proportion of the teeth, a little bit of chroma, and I can tell you that she loves her smile. Let's move in a little bit closer. Well, when we move in close, we see a little gradation of color, we see a little bit of interproximal form, we see a little separation of the teeth, we see a dominant central. And maybe you figured it out by now that there was some veneers there that I had done on her. Okay, so but from the full facial view, to back up for a second here, we look at the full facial view, you wouldn't have known that those were veneers, or hopefully you wouldn't have known, and the composition looks great at a full facial view. And it only looks great at the full facial view because it has this variety that we speak of in art terms and we speak of in principles of dental aesthetics. And it has this dominance, and it has these other things that we're going to talk about shape and proportion, okay, and harmony, as artists would talk about. So let's go through those things. Okay. All right. Now, talking about, it's very hard to find these days people posting pictures of smiles, of full facial smiles. Everybody just wants to post the pictures of the teeth up close. And then when we post the pictures of the teeth up close, like I shared in the previous lecture, if you just looked at these or just looked at these, patients get enamored with just the white effect and they say they want that. But when you stand back again and you look at the gestalt composition, the full face composition, I think you would all clearly say or feel that this is not pleasing. It lacks the aesthetic appearance, the natural appearance. Yes, it's bright, but that's all you can say. So it loses all of those things, the balance that I speak of. It doesn't have any subtle asymmetry. It doesn't have any variety. It doesn't have any sense of movement, any sense of proportion or sense of rhythm. But when you move in and you talk about this is how it's advertised as the criteria for selection for all ceramic systems, or the close-up definitive restoration view, I mean, yes, you might get subconsciously sold that this is what you think you would like, but it's missing the things at the micro aesthetic view that gives it the sense of beauty at the macro aesthetic view. And I'm going to hammer that point home. And I want to prove something to you. There was a fascinating article that Pascal Magne did. Most everybody knows that name. That's in restorative dentistry, especially in adhesive dentistry. He's probably the father of immediate dent and sealing at USC, a friend. And anyway, so he did a very interesting article on essentially showing a smile to lay people and dentists. That's really proving in a little bit a roundabout way what I'm talking about here. So what he did was he took, this is the face, and this is the digitized face. So he made this face perfect. So the right and left are the same, and the right and left teeth are the same. So there's no asymmetry to the teeth, no balance difference. Everything's perfect. So it's that kind of fakeish look. Okay, here's the natural look at the full face view in the center. All right, now, this is dentist, this is the lay people, public, okay? At the normal view with a little bit of asymmetries and everything like that, 47 out of whatever, 100, less than 100, about most of the people like the subtle asymmetries, the subtle variety, the subtle differences at the full face view. The same with the lay public. They all liked this one. Now, when you show them the close-up view, if we move in and show them this view, okay, take away the face and just show the teeth up close, guess which one they pick? Predominantly, they pick the fake view. They picked the distorted fake view, the right left was changed and made what they think is perfect. Okay? We all kind of subconsciously do that. Okay? Because that's not how they normally see themselves. When they see themselves like this, they always pick, look how many picked. Roughly 2/3, more than 2/3. That was 15. Yeah, about 2/3. About 2/3. 2/3 pick it with the subtle asymmetries. Okay, so what happens is they don't pick this up close. They pick the distorted view up close, but they pick this view at the full face view. But you can't get this at the full face view. If you make the teeth like, all right, gotta wait for the computer. If you make the teeth like this, okay, at the close-up view, the patient looks like that at the full face view. This is just really, really important, okay? So how do you control that? I get it. You got your patients, you know, they get a handheld mirror and things like that. That's what they think they want. So you don't let them have a handheld mirror. Try in your work, stand up, put a wall-length mirror so they have to see it standing up at a full body view. And yeah, you're going to have some patients that, I get it, we all have to have, we're going to get those patients that'll walk out with a fake look, okay? But trust me, they end up in different places. Like I told you in the last lecture, that was a large part of what I did, was replacing the fake look, because after a while they go, I didn't want the fake look. All right, let me prove a couple of more things to you here, some interesting things. Take a look at this. Anybody recognize her? Okay, she is beautiful. All right, this was a hard picture to find. Let's take a look at the next picture here, okay? It's actually Cindy Crawford. I wanted to find a picture of Cindy Crawford with a straight-on view because she never let herself be photographed with a straight-on view. Now, Cindy Crawford made a ton of money as a model. God, I heard she made $10,000 an hour or something like that, maybe even more. Now, imagine if Cindy Crawford had removed that little mole on her face. That little subtle asymmetry is what made her beautiful. It gave her that interesting look that got her 10 grand an hour. If she took off that mole, she probably wouldn't have got that 10 grand an hour, okay? Now, there she is right there. That's the image. Now look at that facial asymmetry. I can tell you, I am sure she probably never took pictures like this because of her facial asymmetry. Look at her facial asymmetry. She was very careful how she allowed herself to be photographed. Now just for fun, now obviously this is grossly asymmetric. You don't want 500 moles on your face, but the one mole just gave her the interesting character. So that subtle little change. And now look at her teeth, by the way. Let's go back and look at her teeth. She has some subtle asymmetries in her teeth. Her midline is off just a little bit. The centrals are subtly different. This is rotated out, rotated in. Yes, I probably would have done something about the gingiva on that one tooth, okay? But amazing, subtle, beautiful smile, okay? Okay, recognize her. Give you a second. Okay, that's Jennifer Grey. That's when she stopped making money. She stopped making money when she had a nose job. All right, now I appreciate the fact that this is before she had a nose job, that, you know, classically a lot of women would have had, or men too, had a nose job because of the little thing on her nose. And she is beautiful on the right, and she's beautiful on the left too, which is extremely unique. She was an A-list actress before she had a nose job, and then she became a C-list or B-list at least actress. Nobody ever heard from her again. That little uniqueness, everybody, you know, whether you're in Hollywood, whether you're making teeth, everybody likes that little edge, let's say, to make them special. And that for a career was a mistake for her. And you could look up her movie list on Google if you want, and you'll see that she was pretty active. I think she's still doing a couple of things, but she disappeared from the scene after, or at least as a leading lady, after she had her nose done. So I'm not saying don't have your nose done. I'm just saying that, unfortunately, when we don't respect individuality, this is when we lose something. I honestly believe we lose some abilities. Okay, number 2. That was only number 1. Sorry, need to raise my chair up a little bit. Hopefully I'm still on screen there. So emphasis in art, or the dominant element, obviously in our world is going to be the central incisor. And all great art has a dominant element. This is a very simple picture of some rosebud that I took. But I created a depth of focus that allowed that to be in focus and everything out of focus that made it interesting. And we need to think about, you know, making our central incisors dominant but not overwhelm. Okay, and we'll talk about how we do that throughout the series. Obviously, this is Monument Valley. If you've ever been there, I waited till the sun was at a right particular point so that I could emphasize just really that butte, or whatever you call those things, excuse me. Okay. All right, now let's come back to this picture right here. Boy, and that was for an advertisement for veneers, by the way. So many things I could pick about that are wrong with that. But look at the central incisors. Do the central incisors feel dominant to you? Do they, and I'm not talking about being Bugs Bunny or Jim Carrey in The Mask. I'm talking about have a clear separation, have a clear central role, leading lady in her smile. Well, they just don't for me, okay? Look at this here. This was on #porcelain veneers. It blows me away. And that was the after. It just blows me away. I feel so bad for this patient. Okay? I have to take a deep breath. How horrible that is. I'm sorry. It's just the antithesis of what aesthetic dentistry is, okay? And I would just only hope that, I can't imagine that patient really wanted that, to tell you the truth. And I'm sorry if that's offensive to anybody, but somebody has to stand up for this. Incredible. It is. Okay, I'm going to leave that there. Okay, so Jerry Sheesh, a good friend and a mentor, is the one that coined the term central dominance. And in his book, The Aesthetics of Anterior Region and Fixed Prosthodontics, I believe it was 1994, still an excellent book. You can get it through Quintessence. So 2 crowns that I did. And again, the concept is to have a little bit more dominance to the central incisors. We're going to go over proportions, how we decide what proportions, how we decide line angles. And so just with 2 central incisors, creating what Jerry Sheesh calls central dominance. Then the third artistic principle that we'll pay attention in our aesthetic composition is what we call proportion, how we create the right proportions. And I'm going to give you a range of proportions that we've measured. I've measured also what we know from the literature, and that is called an aesthetic proportions and the ranges. Also, what I know from working with patients over the years at the Aesthetic Center at UCLA, patients tend to actually have a little different idea on what they think is aesthetic than what we think is aesthetic. And I'm going to talk about a little concept that I think we all intuitively know that's true. I mean, it's nice to know what the literature says is aesthetic, or is the numbers in the literature. It's more important to know what patients believe is aesthetic. And that is going to be important to understand too, and we'll talk about all of that throughout this series of lectures and online residency. Okay, so proportion essentially is the ratio of elements to one another, and it's important in our aesthetic composition that we create a sense of proportion, that there is a change and a subtle decrease as it goes away from the viewer, but that it makes visual sense. And architecture has used what's called the golden proportion. Teeth don't tend to follow that, but that's a good place to start, and we'll talk about that when we get to that aspect of our essentially aesthetic design. In the art world, this is the literal definition. If you look it up, proportion is the study of the relationships between elements. And they also use the word ideal. So they want to know, or artists would want to know, what is ideal? So it's an accepted aesthetic norm for a particular object. And that they attempt to define that, and even though that is a little bit hard to define. And the ideal is to study the principles of proportion to be able to replicate and copy what is an accepted ideal. Okay, so we're going to talk about that in dentistry. What is the literature accepted ideal for certain proportions, and then some recent literature and measurements that we made and showed to patients on what proportions are. And they're going to be close to what you've heard, but they're going to be a little bit closer to what you see on the screen. And then I'll give you a way to measure and change based on how much space is available. Because another aspect, or the large aspect of how we're going to work with our design, is how much space do we have? And then based on that, I mean, can we do this with restorative dentistry? Or are we going to need to incorporate an orthodontist or a periodontist or something like that? And then living in the real world, you know, the ideal, most patients are going to come to us, especially adult patients, and they really are going to struggle with the concept of adjunctive therapy. As much as we want to do interdisciplinary therapy and recommend it, it's going to be a challenge to get most of the patients to do it. So we're going to try and work with the space, or work in the space of doing it as much as possible with restorative dentistry, but as conservatively as possible. And then Principle number 4, variety. And I will talk about, again, I mentioned last lecture about what I call the final touch, how we create subtle nuances in our restorations, in our color, and our form to create a visual a perception of reality. And that's essentially what artists do, create a little variety in their composition, either in contrast or color, or diversifying the elements just a little bit. So we're going to do that with essentially the shapes of our teeth, essentially the color of our teeth. So it's not boring, it's visually interesting. So again, going back to something that I did in the previous lecture with a couple of more smiles, having my assistant who I mentioned, who is completely a lay person, only works for me personally, looking for another smile. And again, it was very hard to find a smile where somebody showed the full face and the teeth too. So they're either mostly just showing the teeth. And my assistant just loved this. She thought this was one of the nicest results and thought it was a very natural result and just loved. And I told her, I said, I want you to look for something where you see sort of a gradation or a variety. And I was explaining what we were just talking about, something where you see a nice shape of a teeth, a nice smile, a nice face. And we went through probably hundreds of images before we found one that she just loved. And she couldn't tell whether this was either natural teeth or veneers, and happens to be veneers. By the way, the little blue box, I blocked out the dentist's name and obviously her eyes. So she thought this was just fabulous, okay? Just to show you before and after. And, you know, some of the previous things that I showed you, some people were even sort of passing off this upper as fabulous work. The idea that this monochromatic fake white was actually the final effect. So the upper is before and the lower is after. And the point I've been making to you in this lecture and the previous lecture was that this subtle gradation of color or variety, subtle gradation of translucency, is all so important to create at this view so that at the full face view, it's believable. It's not only, believable, but beautiful. Believable, but pleasurable, like we talked about what is aesthetic. Okay, so look at this. Does this give you a pleasing or pleasurable feeling as you look at this? So this is 10 veneers, and I posted this, I don't know, a couple years ago when I did it. And I got some of the best reviews I ever got. Somebody said, this is the best looking case I've ever seen. No, not exactly like that. More along the most realistic case I've ever seen. Let's say that. All right, so let's back out a little bit. So it has, I think, all the things we've talked about. We've got this gradation of color, this nice surface texture. We're going to start talking about reflection lines. We're going to talk about, we're talking about proportion now. And let's back out now. And as we start to back out, okay, as we back out, it actually gets a little brighter in appearance. It appears to get brighter, but it isn't. But because of the relationship or the contrast of the face and the contrast of the lips. Okay? And let's back out even a little bit more. And we look at her full face, and she was completely happy with this. And I didn't do any Photoshop to this at all. So nothing's been changed to this. And it was about, 1M2 or A1.5. And again, she wanted something that was similar in color to her lower teeth, about half a shade brighter. And it's a very believable, bright, beautiful effect. Could it have been a half a shade brighter? Sure. Okay. But, the composition, the shape, and as we back out, it almost starts to look like, wow, it looks a little boring even. You could even say that, it looks a little bit, the right and the left almost looks like perfect symmetry. But we move in closer, and you can see this tooth is bigger, this tooth is smaller, this tooth is rotated out a little bit, rotated in, a little bit more embrasure here, a little bit less embrasure here. All of those things, all the variety, okay, at this view, you're going, wow, you're starting to see a little monotony, let's say. So again, those things need to be there, the variety, the harmony, the flow that we're talking about. All right, the last thing before we get to the framing is perspective and illusion. Perspective is the relative proportions, the relative relationship where you put things in your arrangement. And then illusion is the things that we create with to create a different perception. In other words, and better explain with an example here in just a second. So perspective, you've all seen pictures like this where people are pretending they're holding the Eiffel Tower in their hand, where I take a picture in a way that looks like I'm bigger than the Pyramid of Giza, the Great Pyramid of Giza. And we can do the same things with teeth, with rotations. I'll show you in just a second to create illusion. Another picture of a flower. I create this interesting perspective by overemphasizing the flower and de-emphasizing the background to make interest. Just some more fun pictures I took to just do the same basic thing. All right, so let's talk about how we do that with teeth, okay? So light, shadow, perspective, illusion. Many times we have situations like this, where we've had recession, we've had recession here, we've lost papillas, and we have to create the illusion of a papilla. We have to create the illusion of taper. So in fact, that space as we go gingivally is wider than it was incisally. So incisally, it's actually that wide. It's wider as we go gingivally. So what I've done here is I've created the perception that this is rotated. I use a little interproximal coloration. I create a little taper on the line angle. I create a little bit more taper here. This creates an illusion at a facial view that there is a papilla. It creates the illusion that there is some taper there. And this is all within the realm of what artists do, that they create illusions of 3 dimensions when they're drawing. They create illusion of a shape to draw your eye in a certain direction. That's what they mean by harmony. That's what they mean by flow. And we have the ability to do that. And some of those examples that I showed you that you did not get a pleasing perception, where they used one shade of porcelain, where there was no light, there was no shadow, there was no embrasure form, none of those things were done, okay? So just a case here that this was almost the patient completely tied my hands. Some old crowns here, and this is actually a bridge that's double abutted, 2 ponics back here, and a retainer back here, and she wouldn't replace the bridge due to financial reasons. So I have to do 3 crowns and a veneer on top of a retainer. Okay, so anyway, it goes down to sort of the margin here, and I keep this in a way that she can keep this clean. So creating illusions in different ways with light and shadow. And so these are the things that we're called to do as aesthetic dentist. One of the more challenging things I've had to do recently. So the last thing is talking about frames. So artists use frames to create different effects, to create different perceptions, like the Mona Lisa. I mean, you would not have the same perception of this piece of art without a frame. This frame is at least, I don't know, half, but maybe 20 or 30% of the quality of the perception of what we do, or what the artist wanted you to create. So 4 crowns I made. So these are all different porcelains that I used, okay, and I think that looks pretty good. All with different variety, all creating different sorts of perceptions. Now if I put a frame around it, I think that enhances it, that focus is the viewer, you, right now. And that is essentially us as aesthetic dentists want to do with our frames. And our frames are gingiva, lips, and faces really, but we can't do much about the faces, okay? So we'll talk a little bit about, and we'll have 2 lectures actually, on what the lips need to do and what they can do a little bit. and maybe some design there, and more specifically about gingiva. Okay, and the framing of the gingiva, the shape of the gingiva, the height of the gingiva, and how that affects perception, and how we can play around with that a little bit, just simply with maybe pushing on it a little bit, using a little bit of electrosurge, laser, and or full gingivectomy, and really what that needs to be. And then I'm going to show you some things that maybe you haven't heard yet. You've been hearing about heights of tissue, but I'm going to give you a different perspective based on several measurements I made on where the height should be. This is an implant that Sasha did for me a number of years ago, on both lateral incisors, and the tissue came out amazing. So Sasha Jovanovic did the implants, and I did the 2 lateral incisors for her. Okay, so one last topic here, it'll take about 10-15 minutes, is talking about perceptual skills. Okay, so we talked about the principles, and I think you kind of got a grasp of the concept, and we'll be using those principles throughout, and I'll be referencing those throughout this series of lectures. But let's talk now about this art concept. And I mentioned this once, I'm going to mention it again, is that as you're learning some of these concepts, I want you to start really paying attention to seeing, smiles, seeing teeth, and as you evaluate your patients, really looking at good smiles and asking what it is about that smile you like, what it is that you don't like about that smile. And yes, I want you to develop your own style, but first I want you to really see what is exceptional in a smile, exceptional smiles, and learn how to copy that first, and learn how to copy exceptional teeth, okay? And Picasso was famous for saying this, and everybody's copied it since. Good artists copy. Great artists steal. And then this is, I think, mine. It says the greatest of all time, like Picasso, actually then develop a style, okay? Then you can develop a style, your own style. All right, so there's 5 basic skills 4 basic skills in how to perceive and how to see, okay? And I'll share with you, and then we'll talk about blending those skills into a Gestalt philosophy. So artists are taught, and I want you to start looking at teeth and smiles, basically teeth and smiles in this way. They're taught to look at edges. So as they create, they have a blank canvas really, and so let's try to see a little bit of a blank canvas first, see like nothing's there, and taught to look at an edge or a contour. So we just look at this, right? And we look in somebody's mouth, and these are my wife's teeth, and I'll show your face in a second, and we start to see, okay, maybe you don't like an edge, you don't like this, you don't like the shape, okay? So great. Okay, now the nice thing about some programs like Keynote and Photoshop, we can start drawing in some things, okay? And that's nice. So what I want you to start seeing, and this is how I would recommend you to do, is design your edges first. Design your outside contours, okay? Decide where you want your periphery to be first. And this isn't something a patient can see, okay? This is something that you need to see. Okay, where do you want your incisal line to be? Where do you want your outline form to be? Okay? And so the nice thing about some programs, and I'll show you how to do this in Photoshop later if you don't know how to do this, is that we can draw some lines, and I actually will give you a template with some tracings so that you can bring in a tracing of a smile line, you can bring in a tracing of some shapes of teeth, and then we already can know the aspect ratio, and we can already know basically what this angle might be. And then I'm going to give you some measured angles, let's say, and we're going to come to angles in just a second, what a contour should be. Okay. Then artists are then taught to look, and this is, again, how to start perceiving things. Instead of just looking at the hole first, they do see the hole. You have to see the hole because it's in front of you, all right? But then what do you look at? How do you break this down to perceive what to do? So again, we'll look at edges first, Okay, outline form, the size of lines, things like that. And the next thing is to look at everything outside of your work. And then artists would call that negative space. So this is called negative space. So for us, what does that mean? So if artist is drawing a building, they're going to decide what's going to be next to that building. How much space to the edge of the canvas? If they're going to draw an apple, how much space to the edge of the canvas? So for us, what does that mean? That means if we're going to design some teeth or we're going to evaluate her smile, what do we need to reference it to? For us, we need to reference it to where is it going to go against the lip? Where is it going to go against the buccal corridor? And how much space do we want to fill? So this is how we would relate our negative space. So our negative space is the space to the lower lip and the space to the buccal corridor, and how much space can we fill with that. And we'll go through an analysis of that when we get to the 5 levels we talked about, from facial, oral, dental gingival, and dental aesthetics, and how much of that space we can fill restoratively. And then now beyond restoratively, where are we going to need to incorporate our interdisciplinary colleagues. All right, so the global perspective of this is we want to minimize this black space. In an aesthetic smile, we need a little bit of black space. When it looks like our teeth are digging into the lower lip, or here I think we would clearly agree there's too much black space. That gives us some visual tension, as artists would say, visual tension. So we want to fill some of that space in. We'll decide later how much that space is. We would like to fill in some of that black space or buccal corridor. Now here, we could define this as empty space or black space. We don't like to see so much gingiva, so we're going to define that later, that we want to minimize the amount of red that we see too. So we want to minimize the black space and the red space. Okay, so that's just a simple concept. Steve Snow, in a paper in the 1980s, termed that minimize the red, meaning the gingiva, and minimize the black space. Okay, so it's as artists would define it, the literal definition, they define negative space as the space beyond the edge of your subject, or black space. And so then our goal is going to be, to back up for a second, is to minimize this space. And I'll just give you a quick answer. The ideal amount of space in a normal smile is about 1-ish millimeters, no more than 2. And it's okay if it lightly touches the lip. But if it's digging in or distorting the lip, that tends to look a little bit of a problem. So here's her normal smile, and you can see she's about 1-ish millimeter away there. We could have done a little bit better job filling the buccal corridor on the other side. Oops, so to speak. Okay, coming forward here. Angles and proportions. We need to use this all the time. And I can tell you this is probably the number one thing that most people get wrong in shaping teeth. And when you look at teeth, I'll show you a couple of examples, you'll see what I mean. And I think all of us had this experience subconsciously. You'll look at some teeth and you'll say, okay, the basic shape or edges and contour look okay, but there's something wrong. You notice something wrong, and it's usually angles and proportion. Okay, so artists use something, they call it sighting, and maybe this will help you a little bit. I'll share with you just a term, they call it sighting. They use something like a pencil, or they'll use something like a grid. And they'll just draw a grid, or they'll hold a grid up in front of whatever they want to do, and they'll use a clear piece of plastic with a grid on it or something like that. You might see on the right there. And what that tells them to do is that this piece is in this grid, this piece is in this grid, and this piece is in this grid. We can do that with photography. We can take a picture when we're designing 6 veneers or 6 bondings, and you're not quite sure, do you move this line angle over here, or do you move this line angle over here? And we're going to go through that process as we start designing teeth in later lectures. So what do I mean by that? The beauty of digital is we can take a picture and we can draw a line and we can see where a line angle is. You like something. Remember what I said, ask a question. Do you like this shape? Do you not like this shape? If you do or you don't, find out what it is you like. Find out what it is you don't like. So let's just say you love this tooth or you love this tooth. Here's where the line angle is. Here's where the line angle is. Here's where the incised ledge is. Here's where the embrasure is. So you can measure this. You can draw a line on there, and then that line can help you reproduce it in a future piece of work. And we're going to do all of that stuff, okay? All right, so look at these two examples. Did that instantaneously give you pleasure or pain? It gave me a lot of pain, I can tell you that. But it made it in hashtag porcelain veneers. God, there needs to be a filter on some of this stuff, doesn't there? Yeah, anyway, okay. But even just maybe to help whoever did this, forget about the color, okay, and all the other things that are wrong, but just my eye is drawn to, okay, let's just draw, the line angles are wrong. Line angles point to the root tip. This root tip is over here as far as this line angle. The embrasure form is wrong. So there's just several things wrong with the basic shape. So you could take this and about a half an hour of contour and polish and working with the reflectivity of the surface, get something that would maybe be believable, okay? But the person needs to understand then where line angle is supposed to go, what a proportion is supposed to be. This proportion is wrong relative to this. This proportion is a little bit wrong relative to this. There are subtle things. The variety is not even here that we talked about earlier, okay? Now, again, I'm gonna go through and show you in Photoshop how to do these things. You could put a little template on here. Just take a quick little picture if you're having a hard time seeing. Bring it up on your computer screen, and then, oh, okay, if you're having a hard time seeing what looks right or what looks wrong to you, you can help yourself with a digital photograph, all right? So there's certain proportions that teeth need to be. There's certain way line angles are supposed to reflect light and do reflect light in natural teeth, okay, to give a natural appearance. And there's my wife. So one of the things I wanted to share about this is look how nice her smile is. The only thing that bothers me about her smile is that little diastema that's open right there when we back out. Nice bright teeth. I didn't Photoshop anything. I didn't get rid of any wrinkles. She's mad at me about that, okay? And I could have cleaned it up. I didn't clean it up at all. I wanted to show you that how nice a smile is at a full facial view. Again, when we back up, she's got a little thing going on here. Hey, would it be nice to fill that in a little bit? And yeah, maybe a teeny bit longer here. Sure, okay. Yeah, to make it better, okay, perfect, let's say. But at the full faced view, it just works, okay? All right, now just an example of a case. So here's a young guy that came to me. He's an orthodontist, amazing orthodontist, didn't want to do ortho, okay? And I had a real short time to do this, so I'm just drawing in what I want the angles to be, and I see, oh, I can't do two teeth. I got to widen this tooth a little bit. The proportion's wrong. So just some little quick things we can do in Photoshop because I wasn't 100% sure where to go, and I realized that I needed to do 4 teeth, and I really wanted to do 6, and we just couldn't get to it time-wise. Now there's the full smile when I'm done. Now, do you like it? I think it creates a pleasing proportion. I see one thing slightly wrong that creates a little bit of visual tension for me. Okay, now let's move in close. I think you can see it here. I missed the proportion here just a little bit. Okay, a nice thing we can measure. Okay, I nailed the 2 centrals. Because I got the proportion right. I got of the centrals. I got the taper to the line angles, but I didn't get the proportion for this to this. I needed to make the relationship, I needed to make the lateral look a little bigger. Now, how I could have done that, I could have either made the central a teeny bit narrower, okay, or I could have brought the line angle a little bit more over here on the lateral to create the illusion of it being a little bigger. So is it good? It's good, okay. But, this is the way we evaluate line angles and proportions to see better. Okay, so let's finish with, or not finish, second to the last topic, light and shadow. So let's look at a single central. And nothing's harder to do than a single central. So this is on top of an implant. This is a case Sasha and I worked on, and I never got a chance to do this composite. She moved. Of course, we were planning on doing the composite, so we were rushing to get this done. And now, here, I want to measure this real quick. So there's the abutment. So there's the measurement, mesial distal. This is the exact same measurement, mesial distal. So I had about 3/4 of a millimeter extra space, extra width. But I think you would agree that the perception is that that's the same width, very close. Now, how did I do that? You play with light and shadow. Look at this line angle. So line angles, proportion. I couldn't create the same proportion, but I could create an illusion. This line angle is the same as this line angle. Well, almost the same. Needs a new composite. This line angle is the same as this line angle. I brought it in just a little bit. I created a little shadow on the distal hair to create the perception of narrowness. Okay, and there she is smiling. I didn't do any specialized. I didn't get a chance to get her in for any portrait photography because I thought I was going to get to do the composite. I thought we were going to do the composite, and I said, okay, great. Can't even remember her first name right now. I'll see you. We get the composite, we'll do a portrait. So this is just a little quick on-camera flash. You can see we didn't play around with it at all. We didn't do anything to clean the image up, but it's a good result, very good result under the circumstances. All right, then the last thing is the gestalt, bringing it all together. All right, let's look at Kati. This is one of Dr. Johann's patients. We did the dentistry together because he hadn't done, when he just came, he had not done a minimal or no prep case, and we'll talk about her later. So I do a little bit of a smile design on her. So she wanted no prep. So we did a modified extreme minimal prep on her, and we'll talk about her in the prep section. So there's the digital smile design. And here are the 6 veneers. Now, as I did the smile design here, I think I didn't do a good job on the smile design. I did not emphasize the centrals enough, so I emphasized the centrals a little bit more here. So you can see I created a little bit more central dominance that Jerry Sheesh speaks of. And I definitely think it works better here. So look at these pictures here. So this works really well at the full face view, which I keep emphasizing that this is critical. And people say, well, the full face view, we don't need to put those effects in. The micro aesthetics doesn't matter because this is what matters. This is what matters. It's the full face view. Yes, this is what matters. But to go backwards, if you don't have the micro aesthetics, if you just have the boring monochromatic, left, right, perfect symmetry at the full face view, it looks fake. And you can start to see even at this view, it almost looks a little bit fakish because I did minimal micro aesthetics. There she is with Dr. Johann. Okay. Now I'm creating illusions, ladies and gentlemen. All right, so when she got done, she's actually a professional model. I asked her to pose for me, and she has clothes on. Below she has clothes on, okay? So, all right, so finishing up. Number 3 in this series, okay, artistic principles, and then we'll move on to actually analyzing our patients, some patients, and then eventually some treatment. So our goals in aesthetic dentistry, what I believe, is to create teeth of pleasing inherent proportions and of pleasing proportions to one another. And then from Jerry Sheesh, to relate a pleasing tooth arrangement and color in harmony with the gingiva, lips, and face of the patient. Thank you, everybody, and we'll see you in lecture number 4.